So I'm going to be talking about the GDC guidelines. So this is what we as dental students and dentists have to follow. The GDC is our governing body as dentists, and they have specific bullet points as listed on the PowerPoint in terms of how we should be acting as dentists and how we can be competent. Kings really like to hear the GDC guidelines being spoken about in the interview. It's something that I tried to also, similar to the four principles. It's very important that you kind of have a clear understanding, a good understanding generally of the GDC guidelines, so that when you are looking at any scenarios that you might be faced with, or just in your interview in general, if they do ask you a question, even if there's something that can throw you off, if you're getting thrown off by a question, it's a very good way to kind of, if you think about these guidelines, you can allow yourself to have a direction in terms of how to speak in your interview. And it will prevent waffle, I guess, in a sense. And so to just go through them, it's putting a patient's interest first. And this is the very first one. It's the most important one, because ultimately as dentists, we are healthcare professionals, and we do need to make sure that the patient's interest is first. Communicating effectively with patients is one thing that I constantly talked about in my interview, especially because in interviews, when you are interviewing at a university, they are looking at your communication skills. And so being able to identify that this is not just a skill that you need in an interview, but a lifelong skill that you need in your profession, it's a really good one to highlight, that you need to effectively communicate with patients, because it links on to the next point, which is to obtain valid consent. And so I'm not sure if everyone knows, but before you do anything in dentistry, before you start cleaning someone's teeth, before anything you do, you need to make sure that you obtain consent before any procedure from your patient. And you need to be able to communicate effectively with the patient in order to obtain valid consent, because there's a difference between gaining consent and valid consent. And valid consent means that the patient needs to understand what you're saying, in terms of whether that be procedures, future procedures, ones that have happened before. The first three are extremely important in interviews, and these are the ones that I mentioned a lot. Maintain and protect patient's environment is confidentiality. So this is just something that is good to know for whenever you have a clinical scenario, just making sure that you're not breaching the patient's confidentiality. Having a clear and effective complaints procedure. This is not so much relevant in the interviews, but just knowing it is good. I don't think there's anything harmful with knowing about the complaints procedure. So that's just if a patient feels like they haven't been treated well, or you haven't effectively communicated, they can complain, and they have a right to complain, and it can go to a higher governing body if deemed necessary. Again, so this one is work with colleagues in a way that is in the patient's best interests. And so that's really working in a team, being able to have that team bonding ability, because as dentists we will be working with nurses, receptionists, hygienists, so it's really important to be able to work well and cohesively with your colleagues to provide a very to put the patient's interest first, and to be able to provide good quality care. So maintain, develop, and work within your professional knowledge and skills. So one thing that there was a question before about technical skills, and technical, I feel like, I don't know if you're referring to like chemistry-based knowledge or like scientific-based knowledge, but one thing that I'd say is really important to know outside, in terms of outside knowledge, is this point here, and it's to maintain, develop, and work within your professional knowledge and skills. As dental professionals, we do need to constantly be learning, and we are expected to do so every single year. And that's why the word develop is very important, because we have CPD, which is continued personal development, and that is to make sure that as dentistry progresses as a career, there's always going to be changes because of things like technological advancements and social media and things of that sort. And so being able to move with that, with the way that technology is advancing, for us as professionals to be able to improve our knowledge in that same rate, it's very important. Raise concerns if patients are at risk is kind of similar to putting patients' interests first. You need to make sure that the patient is safe, and just making sure that you do everything that you can to reduce the risk to the patient. Make sure your personal behaviour maintains patients' confidence in you and the dental profession. So that's just making sure that you remain professional at all times. you do have to have a personal kind of relationship with your patient, and I'm sure that you've noticed that when you do go to the dentist. But making sure that that is within the means of being professional is really important. You don't want to overstep your boundary, because that, if a patient does feel uncomfortable, then you will be taken to court. It is a very sticky situation, and it's a very messy situation, but it's very common, unfortunately. And so having these guidelines in your head is very, very good in the interview, because it does prove to the interviewer that you do have a passion for dentistry and you do understand the basics of what it takes to be a dentist.
Just to add on very quickly, you don't also have to think about GDC guidelines once it's an interview stage. And as Joanna mentioned, it's so important that you pick some of the bullet points from here and have them in your head, have them ingrained when it comes to the interview. So as Joanna said, she had the top three, which she constantly reiterated during her interview stage. But even when it comes to personal statements, you can talk about this when you do your work experience. So I remember when I was writing about my work experience, I didn't know how to tie in what I had seen and what I had learned. So what I did was I just looked at the guidelines and sort of copied it. So I would say something like, the dentist did X, Y, and Z on the patient, and I could see how she communicated effectively. And that's point 2 of the GDC guideline. So you can literally go through the GDC guidelines and use it to explain what you've learned from your work experience, because there's nothing better than what the governing body have written out. And you can even say, like, upon reading the GDC guidelines, I've seen how professionals have worked in line with the guidelines, and it's given me an appreciation for dentistry as a whole. And it can help you so much, not only in your interview, but personal statements as well. So be sure to at least give this a read now, and in your own time, learn them to the best of your abilities, because it will definitely help you in all aspects of your application.
Yeah. And just to quickly add that this has come directly from the GDC Guidelines website, so the GDC website, and they do have subtopics, and they do give you scenarios where you can apply this information. And I've noticed that this was really, really helpful for my interviews, where there was clinical scenarios that we were given, and having done some scenarios from the actual governing body was extremely useful in being able to tailor my answers in a way that was suitable, as opposed to just straight out of my head. The GDC guidelines, like I said, is something that all dentists have to abide by, and so it's something that the interviewers are having to look out for as well.